It is now my pleasure to introduce the speaker for today's transition ceremony. Dr. Anthony Palumbo is a 1995 summa cum laude graduate of Life College. He had the honor of acting as his class salutatorian. Following his college's credo, to give, to do, to love, to serve, out of your own abundance, he has proudly contributed to the profession of chiropractic in many roles. Dr. Palumbo is a longtime member of the American Chiropractic Association and is currently serving in the role of president of the New York State Chiropractic Association. He has attained 2 diplomate statuses in electrodiagnosis and holds a director's seat on the exam board for the American Chiropractic Association's Colleges of Clinical Electrodiagnosis. Dr. Palumbo is an adjunct professor of postgraduate studies at Northeast College of Health Sciences. He has served as an expert witness on many occasions on behalf of chiropractors. Dr. Palumbo has enjoyed being in private practice for the past 26 years and holds active licenses to practice in New York, New Jersey, and Florida. He is currently part of a multidisciplinary healthcare team at New York Chiropractic and Physical Therapy on Staten Island, New York. His greatest joy in life is spending time with his family and serving as the head coach for his hometown high school's junior varsity ice hockey team. Please help me welcome Dr. Anthony Palumbo.
Well, first let me say, sitting up here with all these white coats and a gray suit, I feel like a piece of dirty snow. But I'm so honored to be here today. And before I read what I wrote down on this paper, and hopefully it will help you in your careers going forward. The people who sit before you are absolutely the ones who are supporting you in your academic career. But let's not ever forget the people that are sitting behind you. And I think it's very important to give them a round of applause because those are the people who support you. They support you in your life, and I'm sure they'll always be there for you. So, future doctors of chiropractic of the class of 2023, I'm truly excited to be standing here before you today. In the many years that I've been in practice, there are times that I feel humbled to be part of this profession, and this is most certainly one of those times. I appreciate the nice introduction that Dr. Poirier gave to me. I want to thank the staff of Northeast College for their hospitality, and I especially would like to thank Dr. Meston for inviting me here today to share this experience with all of you, and also for being a partner in the advancement of chiropractic and for truly being a friend. I'm a full-time practicing chiropractor in my 26th year of practice. I remain in the trenches and experienced all the adversities that practicing doctors face daily, so I believe that I have a good understanding of our profession from the inside. As the president of the NYSCA, I am fully committed to acting in the best interest of all practicing doctors and their patients and growing the profession in a positive manner. I recently turned 50, and this milestone caused me a great introspection of my life and career. I struggled with certain aspects, but I realized a very important thing. This profession is not about me or my contemporaries anymore. It is about you and the generations of chiropractors behind us. I want you all to know that I fully recognize the needs of the younger generations of doctors behind us. Securing your future and growing chiropractic, especially in this state of New York, is a top priority for me. I have shared my experiences in speaking with many of you today. In my 26 years of practice, I have certainly been around the block more than once. In fact, I have been around the block many times. I have had many opportunities in this great profession in many different aspects. I have not always succeeded. In fact, by most measures, I have failed several times. However, I live by 2 mottos. Number 1, failing is a natural part of trying and learning. And number 2, the opposite of strength is not weakness, it is complacency. So I say to all of you, try hard even if you fail, learn, and most importantly, never be complacent. Life is harsh sometimes and teaches you valuable lessons when you least expect it. Years ago, I was provided with one of the most powerful learning experiences that the universe can offer. I was diagnosed with a brain tumor. I had surgery and by the grace of God made a full recovery. I was a sole practitioner at the time and lost my practice. Again, by the grace of God, I found my way and made a comeback. 20 years later, I am here, stronger and wiser for this experience. And for the record, as Dr. Poirier told you, I hold licenses in New Jersey and Florida, but I have made my comeback, raised a family, and lived a great life in New York. Don't be fooled. This state is not such a bad place to stake your practice. I can assure you that I do not stand before you believing I'm better than any of you. I look forward to the day when I can call you doctor, and I also look forward to you being my peer. I have merely had a head start walking the path that you have essentially only begun. So hopefully by addressing you today, I can save you from some of those bumps, bruises, and scraped knees caused by the rocky portions of the path. To quote a line that Bill Murray's character spoke in the movie Groundhog Day when comparing himself to God because he knew so much by living the same day over and over. Maybe he, God, is not omnipotent. Maybe he's just been around so long he knows everything. I'm a God-fearing man, so I would never compare myself to God, and I would never be foolish enough to tell you that I know everything. But I've certainly been around long enough to share my knowledge, share the knowledge I've gained through my experiences with you today. To me, the key to practicing as a doctor of chiropractic is embracing the fact that you are unique among the other healthcare professionals. You are a chiropractor and must always remember that that at your core, correcting a patient's spinal distortions, vertebral subluxations, misalignments, whatever you want to call them, is what separates you and makes you unique. However, you can never forget that you are also a doctor and have a responsibility caring for the patient's overall health and well-being. Finding the right balance of the two aspects of your degree is what will make you a great chiropractor. When it comes to commencement speeches, in my opinion, the greatest speech ever was the one that has long been attributed to Kurt Vonnegut, but was actually a column written by Mary Smith for the Chicago Tribune. It was about a speech she would have liked to give a graduating class. Sadly, the speech was never given by Vonnegut or Schmitz, but it was made famous by the Baz Luhrmann song back in the 90s, back when you guys were just babies. I've always been inspired by the words in this speech/song, and I freely admit to you now that I have borrowed some of these words for this speech for educational purposes only. Just want to let the faculty know. Let me begin by saying that if I could offer you only one tip for the future, chiropractic adjustments would be it. The benefits of chiropractic adjustments have been proved by scientists, whereas the rest of my advice has no basis more reliable than my own meandering experiences. I will dispense this advice now. Instead of a boring speech, my advice will be shared mostly in a series of non sequiturs. Don't worry about the future, or worry, but know that worrying is as effective as trying to solve an algebra equation by chewing bubble gum. The real troubles in your life are apt to be things that never cross your mind, that never cross your worried mind, the kind that blindsides you at 4 p.m. on some idle Tuesday. Or that blindsided me yesterday when I was getting ready to leave to come up here. My EMG machine broke, so that was fun. Don't waste your time on jealousy. Sometimes you're ahead, sometimes you're behind. The race is long, and in the end, it's only with you. Remember the compliments you receive, forget the insults. If you succeed in doing this, please call me and tell me how. Don't feel guilty if you don't know exactly what you want to do with your life right now. The most interesting DCs I know didn't know when we graduated chiropractic school what they wanted to do with their lives. Some of them went on to do the most amazing things in our profession. Stretch and exercise and encourage your patients to do the same. Take vitamins and eat a healthy diet and encourage your patients to do the same. Be kind to your joints and encourage your patients to do the same. You will both miss them when they're gone. Maybe you'll open a private practice and be your own boss. Maybe you won't. Maybe you'll join a group practice as a partner. Maybe you won't. Maybe you'll be an employee of a large practice. Maybe you won't. Maybe you'll teach like these great professors up here on the stage today. Maybe you won't. Whatever you do, don't congratulate yourself too much or berate yourself either. Your choices are half chance, so are everybody else's. But work hard and give effort. Take directions from your mentors and peers, even if you don't follow them. Do not ever read research articles with the point of view that you should know everything in them. This will only make you feel dumb. Get to know your patients. You never know what joy they can bring you. Be nice to your staff. They're your best link to your patients and the people most likely to stick with you when the chips are down. Understand that trends come and go, but your core beliefs based on facts should never falter. Always be willing to bend yourself to the individual nature of each patient, but never break. Accept certain inalienable truths. Prices will rise. Reimbursement for your services will seem to decline. You too will get old. And when you do, you'll fantasize that when you were young, fees were reasonable and your overhead was low. Respect your parents. Let's face it, for most of you, without them sacrificing, you wouldn't be sitting here listening to me right now. Be careful whose advice you ask for, but be patient with those who supply it. Your critical thinking skills are grounded in several things: your education, your observational abilities, and your intuitive common sense. Your clinical judgment supersedes any textbook. Evidence-based practice is an amalgam of the best scientific evidence plus patient values and circumstances plus your clinical experience and expertise. When it comes to x-rays, be systematic. Develop an approach for interpreting x-rays and use it to the day you retire. Be patient. Do not rapidly flip through x-rays or use the ceiling light as a view box. Be critical. Don't accept poor quality in your x-rays and demand they be retaken if they are. And be skeptical. If you see something that doesn't look just right, act on it and order an additional study. There are no true time factor rules when it comes to ordering diagnostic studies. If you have clinical evidence or a true gut feeling that a study is needed on day one of the patient encounter, order it. According to the Hospital for Special Surgery in New York City, 97% of low back pain is mechanical. So when you hear hoofbeats, think of horses, not zebras. But never assume and always question. Most importantly, trust your spidey sense. Practice according to the Scout motto: be prepared. Don't be reckless with your patient's health and well-being, and don't put up with other doctors who are reckless with theirs either. Don't forget to ask the patient what their goals and expectations are. When it comes to evaluating patients, history is the most important. It is the foundation of every doctor-patient encounter. Your clinical judgment is the final determining factor for all of these encounters. When it comes to treating patients, teaching patients about the biology and physiology of their pain experience leads to greater positive outcomes. Providing compassion is sometimes greater than providing a diagnosis. Sometimes you are a psychologist, sometimes you are a pastor, sometimes merely putting your hand on a patient's shoulder and telling them everything will be okay is enough to get them over the hump. Rely more on your reflex hammer and rely less on your orthopedic testing. Everyone is a candidate for chiropractic care. They just may not be at the time they present to your office. When in doubt, refer out. Notes seem tedious and unimportant until somebody asks for them. A good note is worth an hour of wasted time. Smile. Be meticulous, but be expeditious. Never stop learning or advancing yourself. Read. For God's sakes, read. Join a professional organization. It is your duty as a professional, and it will forge bonds that will last you a lifetime. And lastly, always remember, most advice is just a form of nostalgia, Dispensing it is a way of fishing the past from the disposal, wiping it off, painting over the ugly parts, and recycling it for more than it's usually worth. But trust me on the chiropractic adjustments. Thank you very much.
Thank you, Dr. Palumbo. Please stand up. Join me here. Thank you for taking time out of your busy schedule to be with us today and sharing those words of wisdom. In addition to that, thank you for your leadership in the state of New York and the entire chiropractic profession. It's much appreciated. With that, I'd like to present you with this certificate of appreciation in recognition of your outstanding contributions to Northeast College of Health Sciences and also chiropractic. Thank you. Thank you very much.